All right. So my name is Mel Randleman, Mel Hosbrough-Randleman, if you want the technical hyphenated version of my name. And I own Aesthetic Inc. It's a permanent makeup and tattoo studio located in Washington, Illinois. Here's a little info about me. I was born and raised in the area. I do have an art degree from Bradley University in graphic design and marketing. So that's kind of helped me create the business that I have specializing in the areola tattoos. I'm also a licensed esthetician. I actually graduated from Chakotay University in Peoria. I was the first class when they opened back in 2006 and graduated as the top of my class. They actually wanted me to stay on and teach, so that was pretty cool. But I decided I just wanted to jump in the field, so I went right at that direction. The reason I do permanent makeup and tattooing for breast cancer is I actually have family members that have been affected by breast cancer. So it's very near and dear to my heart. So that's why my passion is where it is. I also, like I said, is a licensed tattoo artist, permanent makeup artist, and esthetician. So I'm actually internationally trained in basic and 3D areola reconstruction. So that's just a little tidbits about me. So I'll go ahead and move to the next one here. So basically, I created Aesthetic Inc. to fill the need in the area because I didn't know of anybody doing areola reconstruction tattoos. And so I've worked in the medical field for many years with my aesthetics, with doctors and plastic surgeons over the last 15 plus years. And so throughout that journey, it kind of just led me to this. So basically, I've had people travel from out of state to me to get these tattoos just because they were unaware that it was available anywhere near them or they didn't have an artist in their area. So I made my business kind of a niche to meet that need. And basically, I'll just kind of go through some areas. Is areola tattooing right for certain people? People that have gone through breast cancer reconstruction are a candidate unless their breast tissue is too far damaged or not thick enough. Most people can get the tattooing. It's just basically dependent on how long they've been post-surgical. I usually like to wait at least 4 to 6 months before they have their tattooing done. You want, if they've had reconstruction with implants, etc., you want to make sure that that has settled in the area where it's going to stay, just so if you do tattoo, it's not going to be higher or lower than where it's supposed to be at. Basically, next, you guys probably know, what is areola reconstruction tattoo? It's basically where I recreate the areola on the breast where they have lost that area. Over the years of me doing this, there's been people who just overall have no areola left. They had the entire area reconstructed. So I'll completely reconstruct that areola with a nipple. I've had some people that have done nipple sparing, so I can actually recreate the nipple to look 3D with that nipple sparing, because a lot of times that nipple that's recreated, they do the best they can, but they can't quite make it look as realistic as people would like it to look. So I can go in there and recreate that, making that flat surface look 3D. You can also do a variety of different things. I also do scar revision. I can help with keyhole scars. I can help with breast lift, augmentation, and any surgical scars I can camouflage too, as long as their scars are white. As long as they've healed to that consistency of a lighter color, not pink, I can actually color them and help them look better and not as noticeable. So that's one thing I kind of like to do too, is not only just the areola, but the scars too. Let me see if there's anything else that I need to say in here. But first and foremost, I always make sure they have clearance from their surgeon. If they're not cleared from their surgeon, obviously I'm not gonna do anything. I want to make sure they're okay in that direction. Contraindications, there are some. Basically, in the state of Illinois, medical or not, I can't tattoo anyone under the age of 18. Obviously, pregnant or breastfeeding can't do that either. They want to be at least 6 months out of chemo or radiation, just so that skin is in a healthy enough condition to be worked on, because it does put a little trauma on that skin. Same with radiation, as I mentioned. Basically, people who tend to be a smoker, if they tend to heal a lot slower. So I usually like to say, if you're a smoker, try to obviously not smoke for, I'd say, at least 3 months or so before I touch you, just because you want that skin healthy enough to heal, just as with them going through chemo or radiation. Obviously, somebody taking like an Accutane or something too, that can affect the integrity of their skin. So usually that's a 12-month waiting period for me as well. Vitiligo is another issue that can sometimes be treated just because their skin is lacking that pigment. So sometimes putting pigment into it doesn't always necessarily take as well. They may take more than one treatment, but they always have that chance of having that color be a little variant. just because of that condition. Diabetes is another thing that can kind of make things a little more difficult. Just the healing process can be longer. Again, if they have medical clearance with any of these things, I will still go ahead and tattoo them, but I always want to make sure their doctor says it's okay first. Basically, how does it work? Well, basically, first and foremost, I'll have them come for a free consultation with me. I go over their medical history. I have a form filled out. It's very inclusive. I want to make sure, all my boxes are checked with them. Everything's good with their doctor or their surgeon, and make sure that they're actually at a point in their life that they are okay and in a good mental state to have their areolas redone. A lot of people going through breast cancer and chemo sometimes have a hard time accepting what they've gone through and being ready to take that next step. So a lot of times I've had, I'd say 4, 5, 6 women come to me for their consultations, and they're just not mentally in the spot to talk about it or to take that next step. They just haven't healed enough to do that. So I usually say, take your time. We can have another consultation. When you're ready, I'm here for you. Sometimes it just takes more than one visit for people to be ready for that. And that's just kind of time they have to take to heal. But the good thing about it is usually by the time they come to me, I'm that last step. I'm that last step that they have to help them feel complete again. And when they look at themselves in the mirror, they see a complete form of themselves, not the void that they had from going through their treatment. Basically, areolas can be created in a variety of different ways. A lot of my recent breast cancer survivors have actually taken a picture of their areolas before they had surgery. And then if they bring me the picture, I can actually recreate the way they looked before. So then they could look very similar to what they had. And if not, I can actually just basically kind of go off their anatomy and basically judge that off of major markers on their body to make sure we get the right size, shape, and based off their skin tone, pick the right colors that look the most natural for them too. So it's just basically a visual thing. Being an artist really helps with this. And some people take usually I do the first initial appointment, and then usually between 6 and 12 weeks later, I will do a touch-up just to see how well their body's holding that color. And if a touch-up is needed, we kind of tweak it to whatever we need to do to make it stay and look the most realistic. And then how long does it last? So typically everybody's a little bit different. Everybody's skin tone's a little bit different. The integrity of their skin's a little bit different. Most people, I say, get 2 to 5 years at a minimum with their breast cancer reconstruction tattoos. Some people are right at that 2-year mark. Their body just metabolizes pigment and color faster than some others. And some people get 5+ years. So I won't see them for quite some time, which is great for them. And some people just it just fades out slowly. So if they come back to me before it's all the way faded, I basically just use that as a map to recreate it again. And if they have any tweaks or ideas that they want from the previous time that I've done it, I actually just make that creation with them as we're going through everything. I have a little tidbit down here about MRIs. Everybody asks me that question, are they MRI safe? Yes, I use pigments that are cleared to have MRIs. They do not have any metal or anything in them that actually will react with the MRIs, which I make sure that's always the case because you don't want any surprises, obviously, in this arena to have a burn or anything come up. So that's one of the most things that are most important for me is make sure I have the right products that I'm using, but they're all safe for that. And then tattoo creation, I kind of touched on that a little bit ago, but basically this kind of goes through how I meet with them and how I do the tattooing. So basically they arrive at the appointment, and if they have pictures, I go ahead and look at those and kind of base the size and shape off of that. We agree upon the design from their pictures or from what I create. Pictures are taken to document all of this. And once their tattoo is created, it's usually covered for about a week, just so that color stays. If they do have a buildup of excessive lymphatic drainage or anything, I give them Tegaderm to take it off and reapply it, but they want to keep them from getting wet for the first 7 days to make sure that color stays kind of like a real tattoo, kind of the same healing process. After the 7 days, they're free to go without wearing anything over them, no Tegaderms, no gauze or anything like that. And with people going through breast cancer reconstruction, they typically do not have any feeling in that area when I do tattoo them. If they do, I can numb. If not, I just usually start. And if they feel something, they usually let me know. But the ironic thing is usually they don't feel anything in the breast area. It's usually somewhere else from where they've had a transfer of tissue. So that's always interesting. I've had people have sensations up in their neck area. I've had from the back, I've had in their lower tummy area. So that's always interesting. As I'm tattooing, you never know if they're going to have a sensation, but it's usually not in this area. And basically, does insurance cover it? So yes, insurance will cover the life of them getting breast cancer reconstruction tattoos. However, it's dependent on the state. So I've been working with insurance. So I'm in the CAHQ system. So I am independently credentialed and I have my own NPI number. However, in the state of Illinois, it's a little more difficult to bill insurance because I'm not affiliated with a medical practice. So it's been taking me literally, it's almost 4 years in the making of trying to be able to direct bill for me for my patients. So instead of being able to direct bill right now, which I'm still in the process of, I actually give them an itemized bill of what I've done, what their diagnosis codes are, their ICD-10 codes, and then I actually submit them an invoice to turn into their insurance. And basically they turn it into their insurance. If their insurance kicks it back, I continue to resend that to them with what they're requiring of me, hoping, praying that they can get reimbursed because it's 100% coverable for their life of their tattoos. So, and if they get an implant exchange, same thing. If somebody had their tattoos done 5 to 7 years ago or 10 years ago, and they have their implants switched out and their tattoos have faded, they again can get their tattoos done at no cost to them through their insurance, which is one thing that's really, really good. Major Medical does cover that. This is basically an overview of what services I offer since I am an esthetician and I do permanent makeup and tattooing. I also offer, as I mentioned before, areola reconstruction, scar revision. I do brows and eyeliner as well. I've done that a lot on my oncology patients when they're not in treatment. I also offer oncology aesthetics too. I've been trained in that as well. And I also do makeup applications too. So anything an esthetician would do or permanent makeup tattoo artist, I offer that at my place as well. And then on to some pictures you guys can see. I have a variety of pictures here from different people that have given me their okay to show. So the first picture you see here is a patient of mine that had nipple sparing, nipple reconstruction. So you can see she had not a whole lot of color going on, no tattoos before, and then you could make them look pretty realistic. Once they're healed, everybody's breasts are different. Not everybody has reconstruction the same way. Every surgeon's a little different. Every breast surgeon does it a little bit different. So there's a picture there. And then here's some more. The one on the far left, I think if it's in the screen that you have, a surgeon actually did the tattooing on the far left one, and she wasn't happy with it. So she came to me and tried to have me get it as close to the other one that she had because she had a lift done on the other side. So we're going to do some additional scar revision on that one once that scar's a little bit lighter. And then the center one, she had her reconstruction was beautiful. So I just had to add a little artwork on there for her. But everybody's different. So every areola, as you see, is kind of like a little piece of art. They're all different. Not everybody's the same. And then here's some additional ones. Far left, she was about 6 months post-surgery. So hers will settle a little bit. That's why I did them a little bit higher. They're still going to drop. Hers are pretty tight in the skin still. The center, she actually had breast reconstruction and her breast redone from about 10 years ago. She did have previous tattooing, but it had faded quite a bit and she wasn't happy with the color. So I actually readjusted her color and did a little bit of scar revision in that center one. And then the left one, or your far right one, sorry, I'm backwards looking at this, is just basically kind of how I map out a little bit of what I'm doing and then draw in basically color and dimension. I have just an area. Do anybody have any questions specifically for me? Sorry if I rushed through that.
Are these usually just done in one session?
Yes, so if it's lateral or bilateral, I do it all in one session. So if it's lateral, it usually takes me about an hour and a half to 2 hours because I'm trying to match the other side. And if it's both, it takes me usually about 3.5 to 4. But yes, it's all done in one session.
Okay. What inspired you to become an esthetician, tattoo artist, and a permanent makeup artist?
So I've always loved skin and skincare and makeup since I started wearing it back in junior high, high school era. And I just always put it on my friends. I'm an artist by trade. I've got a degree in art from Bradley. So I did a lot of figure drawing actually in college, pretty much every year at Bradley. I did figure drawing, which is drawing the figure female and male. And so I've always had an interest in kind of helping people. So that's why I did the aesthetics. So I'm helping people with their skin, with skincare conditions, helping them make their skin as healthy as I could. And then once I started not working at traditional, I call foo-foo spas, don't laugh at me, but traditionally spas that don't do more medically sided treatments. When I started to get into the medical arena working for medical facilities, there was a need for it. And a lot of the physicians I worked for and plastic surgeons were like, hey, I really think you should do this. We don't have somebody in the area that we know of that's doing it. You have an art background. I really suggest, maybe you should do this. Like, I think maybe you should, look into getting trained. And I kind of threw the idea around for a couple of years. But what really drew me into wanting to do the breast cancer reconstruction tattoos is I have family members that have been affected by breast cancer. So that's my main reason as them.
Okay. And what CPT code do you use for billing?
So the traditional CPT codes for reconstruction, and it's all dependent on size and area.
Mm,
CPT codes are 1,920, sorry, 11,920, 11,921, and 11,922.
okay. And what ICD code do you usually use?
That one is, hold on. I've got a couple documents here. Okay, CPT codes typically, you may have to double check this with me, but under Blue Cross Blue Shield, it's usually CPT codes 19324 through 19396, depending on their diagnosis.
Okay. And you said it's based off of size, so you're still billing by time or
Yeah.
by,
For the tattooing, typically itself is based off of size. So you
okay,
can combine the three codes depending on the size of the area you're treating.
interesting. Oh, thank you.
You're welcome.
I've got a question. Mel,
Sure.
is it harder to do lighter skin or darker skin?
Actually, it's really no difference because you're using colors based off their skin tone. So obviously, if somebody's lighter, you're going to use lighter tones. So if they have a pink undertone or a neutral undertone or even a golden undertone, you pick that. Basically, it's almost like color matching for makeup. Kind of the same thing. I use anywhere between 5 and 10 colors on any given person that I do. And that doesn't matter if they're lighter skin or darker skin.
This is the artist stuff.
Yes.
Yeah. Okay. And also, I think you mentioned gender affirming.
Yes,
Okay.
I can do that as
So
well.
when you're doing gender affirming, are you, and forgive me if I say this wrong,
Mhm.
are you adding areola tattoos to someone that has removed breast or someone that has added it or both?
You can do it for both.
Okay.
Yep. You can do it for both. There's actually a pretty large community in the area where I'm at. So,
Okay.
yep.
Anybody
Very-
else have questions? Oh,
It's
here we go. It's all over here in the chat. Max says it's a great presentation. How can I find out if medical tattooing can be covered in Colorado?
so most major medical, Blue Cross, Blue Shield, United Healthcare, Aetna, all the major ones will cover it, like they're mandated by the government to cover reconstruction tattoos. It can be designated either by the physician, surgeon, or someone in the office, or it can actually be outsourced out to a licensed tattoo artist. So
Okay.
you can most surgeons know this, but a lot of them don't think if they don't have somebody in their office, they typically don't refer out unless they have connections with somebody already.
Yeah. And is there a resource to be able to find artists in other states? So, I mean, we've got several people that have joined during the presentation
Yes.
and some people all over the place. So, what do we say?
So
Look.
I don't know of one directly that you can find people without just getting on Google and searching breast cancer reconstruction or 3D areola reconstruction tattoo artists. There are a handful of them around the area. When I was trained, the closest person that I knew was in Arkansas and Ohio around me, but I know there's a few more now over the years in my area. So there's it's becoming more popular. A lot more people are wanting to get into it. So,
Mhm. And thank you, Kimberly. Kimberly put information into the chat
okay.
about the Blue Cross Blue Shield and the CPT code. I don't know why we need that, but maybe somebody in here is getting inspired to do more training.
Yeah.
I
Oh,
bill
yeah.
insurance, so I care about the CPT and codes.
Mm-hmm.
Through the VA, I get to bill insurance.
Mhm.
So
Okay.
it's good to know and teach people how to do it.
Yes,
Yes. Yes, it is.
absolutely.
Did
Jen
I?
is in here. Hannah is in here. I knew we had a couple more people.
There we
And
go.
Kelly
Right.
Joe as well. Yeah, so thank you guys for all jumping in here. Does anybody else have any questions for Mel tonight? Does anybody have any more claps for Mel tonight? Because this was some really good information, more detailed than a lot of us actually knew. But Mel, do
Yes.
you have any questions for us?
Probably just how can I help you guys? Is there anything I can do to help you in the future or provide you more information? Or is there anything with what I do would benefit you guys more or how we could work together?
Yeah, I mean, I think so. I'm hoping that as we move forward, since the Society for Oncology Massage is also the Society for Oncology Estheticians,
Hmm?
that we might be able to see estheticians at our next live summit or even at our next virtual summit. And who knows, you could be one of those educators too.
Mhm.
You never know. And yeah, and I mean, honestly, I think that would be kind of a cool niche to have a tattooist and a massage therapist working together
Mhm.
in a similar office or close office or shared office. That might not be a bad idea in the
Yes.
future.
Yep. No, be
Yeah.
good.
Thank you so much for coming, and
Very
we'll make
welcome.
sure everybody gets your information if they need it.
Great.
Okay.
I
I
appreciate that.
appreciate you so much. And
Yeah.
that was really good information. And hopefully all of us can not only be able to share that with our clients, but also with other massage therapists and say, gosh, did you know?
Wonderful. Wonderful.
Another, yeah. Thank you, Mel, very much.
My
And we
pleasure.
really appreciate you being here.
Thank you. I appreciate it. Thank you for meeting all of you and thank you for having me.